During this era of skyrocketing healthcare costs, hospitals continue to search for ways to hold down spending while improving patient outcomes. For one Wisconsin health system, that's meant using new technology to monitor critically ill patients. As WUWM's LaToya Dennis reports, what makes the arrangement unique is the fact that the medical team and the patients are miles apart.
In a building near Mitchell International Airport, doctors and nurses are working 24 hours a day to save the lives of critically ill patients. However, they're not in the room. Only computers are.
You have 5 screens at each nurse's station. The center screen is what we call eCare Manager. Summarizes patient information for the clinician.
Dr. David Ryan is medical director of Aurora's EICU, or Electronic Intensive Care Unit.
We have the vital signs that are the same vital signs that someone at the bedside would be seeing in an ICU. We have the electronic health record. Behind those windows, the physician can pull up x-rays.
The nurses and doctors can also see the patients and communicate with them via a camera and microphone installed opposite their bed. All it takes is the touch of a finger.
Hi, good morning. It's Kathy from the EICU. Just checking because you got a new admission to the unit. Hello, Leonard. So he's sleeping and he's not going to answer me right now.
The camera clarity is remarkable. Doctors and nurses can zoom in so close that they could probably read the name on a pill bottle. According to Medical Director Ryan, the staff monitors all 18 of Aurora's ICUs. That's 250 beds.
So we have 5 or 6 nurses. Each of them follows 35 patients at the most at a time, and they're responsible for finding patient needs and bringing those needs to the patient, to the physician's attention, or talking to the people at the bedside.
If a patient's vital signs fall out of range, an alert pops up onto the screen. The staff then turns on the camera and alerts hospital staff if it's not already responding.
It's in addition to the usual very good care the patients get at the bedside.
Dr. Ryan says the EICU is an effective way to deal with the nationwide shortage of critical care specialists. But Julia Hallisey worries that professional nuanced care could be compromised. She's president of the Empowered Patient Coalition in California.
We don't want to get to the point where we're relying more and more on somebody who has remote access, and maybe just having somebody at the bedside that's kind of relaying information or putting things in the chart, and certainly giving medications and that sort of thing.
Hallisey says her organization has not received patient complaints about EICUs, but will keep an eye on the relatively new technology. It is expensive, according to David Collins of the Healthcare Information and Management Systems Society. Aurora reports spending $7 million a year to operate its facility.
It takes a fair amount of equipment to make an EICU possible, and some very skilled staff to, monitor and oversee the multiple screens simultaneously.
Despite the cost, Collins says interest in EICUs seems to be growing. Michelle Vowles says she understands why. She's comforted knowing that her husband, Carl, is always being monitored while in Aurora's ICU in Summit.
The morning they decided to remove Carl's breathing tube was the day that we talked with Dr. Ryan 3 times that morning. He peeked in while he was resting and coming off of the sedation to see how he was doing with that. The pulmonologist here was in the building, but was elsewhere.
Back at EICU headquarters, Dr. Ryan says patient outcomes are improving. Since Aurora began using its telemedicine system in 2004, there's been a significant decrease in the number of ICU deaths.
So we've reduced it by just over 50%.
Now, Ryan says, it's time for his team to focus on diagnosing and treating patients faster so they recover more quickly, cutting medical expenses for everyone involved. LaToya Dennis, 89.7 WUWM.